Today I want to show you how to measure blood glucose using a pinprick to get blood out of your finger. So the first thing to do is to use this alcohol pad to clean the finger that you're going to get blood from. Choose a finger that you don't use much because it might hurt a little bit for the rest of the day. I'm going to use my pinky. The first thing you do is wipe it down. Now you have to wait for that alcohol to dry. If you get the blood while the alcohol is wet, the test doesn't work very well. It's interesting that we do this before we do the pinprick as opposed to after, and that's because that needle will carry bacteria into your blood if you're not clean ahead of time. So we're going to use this lancet, and we have a box of these in the lab, to puncture the skin, and this really doesn't hurt. The first thing you do is take off the protective cap, and all you do is twist and pull. Now this is ready, and this is loaded. It turns out there's a needle with a spring on the end, and when I push this button, that needle will come flying out. It's a really fine gauge needle, so it doesn't hurt. We press it against the skin, and we push. Can you see the blood? It's coming out. If you don't get enough blood, some of us are bleeders and some aren't, you push a little bit on there, and we get a drop of blood. Meanwhile, get out the blood glucose meter. Get out a sensor strip. Take one out. I'm a little bit clumsy, so these fall all over. There we are. There is the sort of the chip end and the business end. The chip end goes into the device. We stick it right in, and it turns on automatically. So that's pretty nifty. When it's ready, you can see a little flashing icon that's a drop of blood. So again, you want to push on your finger to get some blood to come out. Holding it up isn't necessarily good, and we just put the business end right up to the drop, and a tiny bit of blood gets wicked up into the meter, and then you wait. And it's measuring blood glucose in your blood. Typically, we do this while we're fasting. I had breakfast this morning. You can read this, and I'm at 128 milligrams per deciliter. So that's higher than the average amount, but I ate breakfast about 30 minutes ago, so we know that my blood glucose levels should be a little bit high because I've absorbed glucose from my diet. Now, we're all done. We pull the strip out, record the data, or have your partner record it, and clean yourself up and get a Band-Aid. I do want you to pay attention to a couple of things. We measure these physiological parameters, and we always have to know, is our device working properly? Is the reading what we expect? My reading was a little bit high, but I expected it to be a little bit high, and that's really important because it could be that we just measure it wrong. The other thing I want to point out is we're interested in blood glucose measurement, and that's a variable. And we want to know for the whole population. You really need to compare your values to the classes and to the Food and Drug Administration's recommended values for all of us in the United States. Last but not least, grab a Band-Aid and put that around your finger, and remember, your blood is coming out, so we don't want to mix one person's blood with another because it's dangerous, and we want to dispose of everything properly. Here's another really important point. If you have nice clothes on, grab a lab coat. I have a couple, so it doesn't get on your clothes, and you'll notice I'm sitting down. You absolutely have to sit down when you do this. Some people faint. It might only be 1 in 100 or 1 in 300, but that means one person in our class is going to faint. And I don't want you to hit your head. If I faint from this sitting position, I'll just slump over on the table. That's safe. If I'm standing, my head is going to bounce off the floor, and that really hurts. So please be careful. There's a Band-Aid, and we are good to go. Thanks, everybody. Good luck.